Hello, everyone, and welcome to this month's edition of the Midwest Concussion Clinic Lunch and Learn. This month, I am going to be talking about something that I find very important for anybody who deals with concussion patients. If you're in your own concussion recovery journey, or if you're struggling with feeling lost or invisible in providing support for somebody during their concussion recovery journey, this webinar is for you. The webinar today is titled Concussion Support, Making the Invisible Feel Visible Again. And the idea behind this is something that is very, very important to me. It's something that I find to be completely underappreciated, under-discussed, or even, people have made aware of this becoming an issue during concussion recovery because it varies so differently from person to person or individual to individual. So again, my name is Matt. I am the owner of the Midwest Concussion Clinic. We are a virtual concussion clinic that specializes in providing expert concussion care, treatment, and education to people in the comfort of their own home. I started this business back in 2019 with the idea of providing concussion education and support to people because of so many of these topics that we're going to discuss during this webinar. As always, thank you for watching. Thank you for following along. If you have any questions, my contact information is going to be provided at the end of the end of the discussion today. I am more than welcome to to answer any questions. I will provide any further information that you might have, as well as kind of open up dialogue if you need help on your concussion recovery journey. So the idea behind this webinar is to provide support in terms of what I mean when I say that we can feel invisible following concussions. So objective number one, we're going to actually talk about that. What does that mean? Why do we talk about it being an invisible injury, and kind of what happens to people during their concussion recovery that makes them feel invisible? The second thing that we're going to cover is actually focusing on how we become visible again through the different parts of our life, our journey, okay? The idea behind how we become visible in the healthcare world, to insurance, to healthcare providers, to our primary care, to our specialists, to our rehab team. We're going to talk about how we become visible to our support teams. In that, we're not going to talk about just the patient side, but also how you as an individual providing support can become visible again, and how you can kind of make it easier for the person that you're providing support to understand the injury and understand what you're doing to help them. And then finally, we're going to cover how we can become visible again to ourselves. The idea that we lose self-worth and lose sense of being during concussion recovery is something that I am very passionate about, and how I help my individuals that I work with, and what I kind of discuss with every single lecture or presentation that I give is the importance of addressing mental health during your concussion recovery. So what does it mean by becoming invisible following a concussion? It's something that people will say often when you're talking to concussion specialists or you're talking to people that are involved in concussion research or education. But what does that truly mean in terms of becoming invisible during your concussion recovery? The first thing that we bring up with this concept is the idea that concussions are considered an invisible injury. I mentioned it earlier. What happens with concussions is not only do they not show up on advanced imaging, right? So I'm looking at CT scans, X-rays, MRIs. I can't see anything on advanced imaging. So in the healthcare world, we don't see anything with advanced imaging. We don't see anything on scanning or blood work. So we don't necessarily know how to handle it, right? In the emergency room setting, you're alive, get out, follow up with somebody else. It's hard to look at an individual's scans and say, hey, look, a concussion's occurred, because there is no structural damage that occurs inside the brain tissue itself. The flip side of that is we don't look at a patient and say, hey, look, they've got a concussion, because you can't see anything. Unlike a broken arm or a broken leg, if I look at an individual, I cannot see that they've sustained a concussion. If I have a patient that's really good at hiding how they're feeling on a regular basis, or you're dealing with somebody on your concussion support team, like your a relative, a son, daughter, friend, coworker, even student athlete, or somebody that you recognize, that you interact with on a day-to-day basis, they may not tell you how they feel on a regular basis. You may not be able to see that they're having a good day or a bad day, because concussions are considered an invisible injury. So right off the bat, we're already talking about feeling invisible because people around you that don't understand concussions can't see what's occurring, right? Can't see anything. And when we can see something, we hang on to it, right? When we see that there's an individual with a broken arm or, getting around on crutches or in a wheelchair, we have the ability to help because we know how to help. Part of the problem with concussions being invisible is we can't see it in terms of we don't know how somebody's feeling, or we don't know that even somebody's got a concussion, that we don't often know how to help when we can't see something. In the healthcare world, right, we've talked about the 3 areas that we're going to address. Concussions that make you feel invisible in healthcare, to insurance companies, to your primary care provider, to those around you, and even yourself. When we have those things, those 3 kind of pillars, right, it's a perfect storm of challenges to the mental health systems. When we see somebody that's struggling with all 3 of those parameters at the same time, it makes us really kind of struggle in our concussion recovery, especially on my end when I'm working with a patient, because if they're feeling lost or left behind or unheard or unseen during their recovery, the recovery is actually going to take a longer period of time. So we kind of addressed early that with concussions in the healthcare world, we become invisible right away, right? We can't see it. We can't address it. It's not on advanced imaging or on scans. There's nothing tangible that we can see that you can feel lost. But becoming invisible to the people around you, or even to the healthcare workers and concussion specialists that understand the injury, it's not an immediate process. It's not all of a sudden, you're invisible to people. What happens is over the course of time, those that get it, get it. And those that don't get it, don't get it. And the people that pretend to understand or pretend to get it will slowly over time go through fatigue where it's like, oh, I forgot that you were dealing with this, or I forgot that, you're still struggling because every day you seem like you're doing better. Well, as a patient, it's really easy for me to put on a face to tell people how I feel, right? It's really hard to be honest with people on how you're feeling, especially as you feel like more of a burden or more of a kind of a liability to my team or my coworkers or my employer, more of a kind of burden to the people around me versus, telling people and being honest with how I feel. It's not something that occurs overnight. And a lot of times, especially when we start looking at the process of becoming invisible to ourselves, it's not something that all of a sudden we wake up and it's like, oh, wow, I've lost everything that I've ever worked for, or I have no idea who I am. It's a slow and steady process that may fluctuate during your time in your concussion recovery. For a majority of people, concussion recovery is smooth, right? We kind of move from A to B. There may be some ups and the downs, but concussion recovery, for some people, is really easy. For others, it is very, very, very difficult. And the idea of becoming invisible generally doesn't happen to those people that recover very quickly. It's like, hey, I've got my injury. I recover after a couple weeks, 30 days, kind of getting back into my normal swing of things. My recovery trajectory has gone from, feeling terrible to feeling pretty good, and it's been pretty steady. This is more based on the people that are struggling through their concussion recovery, struggling to kind of understand, the injury themselves, understand what's happening, and kind of stopping that snowball from rolling downhill that makes us go from I'm very honest and open about how I feel to now I just tell people I feel fine because I don't want to be honest with what I feel, or I don't want to have to provide that energy and effort explaining to people over and over and over again that, hey, I don't feel good today. I'm not doing well. So the idea behind becoming invisible is not an immediate process. It's not even a steady one. It's one that fluctuates. There may be certain days where you feel like, hey, I feel seen, I feel heard, I feel validated in what I'm doing. And then other days where it's like, what? I just feel invisible. I feel lost. I feel like people around me don't get it. My providers don't understand. My family doesn't understand. I just can't deal with the day-to-day up and down of feeling like I'm lost or feeling like I'm being left behind. It's not something that occurs overnight. With that challenge becomes kind of the overall big picture with what I want to talk about, is the idea behind becoming visible again. When I say that to people and becoming visible again, it can be met with a little bit of kind of backlash, right? There's a little bit of that head-to-head challenge because, number one, they don't realize that they're becoming invisible, or they don't know how to become visible again. But in my opinion, becoming visible is a choice, but it's not an easy choice. It's not something that you can sit down and say, oh, you know what? I'm visible again. Everybody gets it. Everybody understands. I feel better about this situation. It takes effort. It takes energy. It's challenging. It is met with a lot of up and down, a lot of kind of pushback. But when we talk about ways to become visible again, the first thing that has to happen is we have to make a conscious effort to want to be seen again, and not just by other people. We have to make that conscious effort to want to understand what's going on, to want to know kind of who we are as people. The other challenge with that is it takes energy, it takes effort, it takes, work. And with, a lot of concussion patients early on, especially, I don't have the extra energy to fight back. I don't have the ability to do this. And that's where that concussion support team comes into play that we'll kind of talk about how they're going to help with the becoming visible process. When we look at the topic of becoming visible following a concussion, with this webinar, I'm breaking it down into 3 steps for each one of these, 3 basic kind of steps. I am very, very, very aware of the fact that that is not an easy thing to do in 3 steps. This is something that I can go on and talk about for days with different people, different ways, different techniques. If something works this way, try this. If it doesn't work, how do we substitute that in? But for the kind of the sake of keeping this webinar down in time and not me just going off on a tangent, I am going to focus on providing 3 steps for each one of these processes and how we can become visible again. This is a topic, again, that I've talked on that I am very passionate about. And when I start looking at the idea for a book I want to write, this is what I come back to every single time, is how do we take this invisible injury and make you visible again to the different parts that we're going to talk about. It's not an easy concept to become visible again, but it is a choice that needs to be made. And I will tell you, on good days, it's very easy to make the choice. It's like, hey, I need help. I'm going to fight back. I've got the energy, the effort. Let's do this. It is very difficult on days where we don't feel good, days where we don't have the energy. It's the 50th day in a row where I've had to tell people how I feel or fight back the ridicule of, oh, you're just being dramatic. You're just fighting. You're dealing with this. You need to suck it up. You need to move on. It's something that becomes very challenging to people. That when we're not feeling good, that ability to fight back, to fight to become visible again, is a conscious effort that has to be made, and it has to be reinforced. And that's where the 3 parts of the system can all help each other kind of fight through the ability to become visible again. Concussions in healthcare are very, very challenging because half of the healthcare world understands. Half of them have been updated on the education side. Concussions are a very hotbed topic and, a kind of an area that more and more physicians are being trained in because of the prevalence of them, how frequent they happen, the different specialties that are involved in care. The education side is getting better sometimes. The other challenge with it is if we have an old school approach to concussions, you can be met with that same pushback, that kind of same hitting your head against a brick wall figuratively, don't do it literally, figuratively, of trying to be an advocate for yourself, trying to make sure that the people around you will see kind of what's happening to you and how they can provide care. So again, we talked about, I'm going to break it down into 3 simple steps that are a lot more complex than they sound. But I'm going to kind of go on each one of these steps and provide as much detail as I can. And if I'm providing detail on these steps and you have questions, please feel free to either drop a chat or I can go on to this and provide, further information and updates as we go. But step 1 to becoming visible in healthcare is you need to find a concussion literate provider. And what I mean by that is not just somebody who calls themselves a concussion specialist, but works with concussion patients on a regular basis. One of the challenges with concussions is the idea that it is constantly evolving. New research is coming out. New treatments, new topics, new protocols are constantly coming out that we need to make sure that as providers, we're finding somebody who's staying up to date on them. If you have a concussion literate provider that you've met with and the first thing they tell you to do is sit in a dark room and not do anything, it's time to find a new provider that's actually been trained in updated concussion management. There are a lot of different services that are out there that can help you find a concussion literate provider. One of the main ones being the Concussion Legacy Foundation and Complete Concussion Incorporated. They are 2 companies that have lists of providers that are specifically trained in either in their protocols or have compiled a list of providers that they can provide to you in your state. Again, my whole goal is to help people. So if you're in a certain part of the world or a certain area that you're looking to find a concussion literate provider, I will help you as much as I can. I will probably try to direct you in the right way, try to push you to the right provider to make sure that you are getting somebody who is trained in concussion management and trained in every single aspect of concussion management, not just the evaluation, diagnosis, and then send you back out on your way. So it's very important to find a concussion literate provider. And if you meet with somebody who says they are a concussion provider and you don't feel comfortable with them, don't be afraid to find a second opinion. You're not married to a provider. You know, one of my jokes with concussion recovery is it's as much as science as it is an art form, because we're treating people, we're not treating symptoms, we're not treating numbers. So my way of treating things may be totally different than somebody else's way of treating things. Does that mean I'm right and they're wrong? Absolutely not. What it means is, as long as we're getting the full totality of the picture and how we address each one of these systems together, not just independently, we have the ability to fluctuate in what we focus on. My treatment protocols, I focus a lot on the mental health side of things, and I focus a lot on functional movements. That may not be something that somebody else focuses on, but at the end of the day, being trained in concussion evaluation, concussion management, and being what we consider a concussion literate provider, we have the ability to adapt our treatment protocols based on your specific needs or somebody else's specific needs, not a cookie cutter one-size-fits-all approach. The second step, and this is where, again, it becomes very challenging, is to be a self-advocate, right? What does it mean by being a self-advocate? Being able to tell people how you feel is very difficult post-concussion because I don't understand how I feel, right? I don't understand what's going on. All I know is that it varies day to day. I don't, some days I feel good, other days I feel terrible, but I need to be able to kind of get my life back. And when we talk about getting your life back on track, in the healthcare world, if you've ever dealt with a chronic illness, this is one of the biggest keys to making sure that you're getting the treatment that you need and being visible to the healthcare world. Nobody knows your body better than you. Nobody knows your condition better than you. Even me as a concussion trained provider, I spend my last 10 years focusing on brain injuries, on what's changed, what's not changing, what treatments are evolving, and what we need to address. But at the same time, I have no idea how you feel as a patient or how you feel as a support provider. I don't know how you feel. All I know is I have the science behind it, and I have the wherewithal or the experience to start putting these treatment plans together. But being a self-advocate is key in anything with a chronic illness or a chronic condition, because you know what's good and bad. You know what you used to be able to do and what you can't do now. The idea behind becoming visible again in the healthcare world is a lot of self-starter and a lot of kind of self-advocacy that has to happen. The key phrase, the squeaky wheel gets the grease, in healthcare is a massive thing. If I have somebody who's struggling with concussion recovery, or even trying to find a provider that gets it, or working with a provider for a while and then all of a sudden something changes, you have to be able to advocate for yourself to get the treatment, the testing, the evaluations, the documentation that you need. You need to be able to do that. And one thing that I always focus on with my patients is I make sure that I will be an advocate with them. Even if you're not working with me, if there's a way that I can help advocate for you, I'm big into the concussion education world and the concussion awareness kind of presentation. If there's a way that I can help anybody during their concussion recovery, being an advocate, it's key to establishing and feeling visible again in the healthcare world. The third step to being visible in the healthcare world is staying consistent in your messaging. It goes back and kind of piggybacks on the self-advocacy side of things. Concussion symptoms, concussion recovery, there is a lot of up and down that happens. A lot of inconsistency in symptom presentation and a lot of inconsistency in how we feel from a day-to-day basis. But in the inconsistency, in the chaos, we have to find a way to stay consistent in our messaging. We have to stay vocal. We can't just accept the things that are happening and being told to us, especially if you're feeling lost or feeling invisible. If you have a healthcare provider that doesn't understand your primary care is working with you and they don't know what else to offer, just because they don't have anything to offer doesn't mean somebody else doesn't have a different approach or a different treatment that we can do to help you get your life back on track. By staying consistent in your messaging, you're able to provide a consistent timeline or a consistent message to the different providers. You're less likely to be cast off to the side as somebody who is just chasing different things, somebody who's after different medications, or somebody who's after a different kind of settlement from a lawsuit. Staying consistent in your presentation makes it so you are more, you hate to say it in the healthcare world, but it makes it so you're more heard, you're more seen, because you're not seen as somebody who's bouncing around from different place to different place, telling everybody different things. Staying consistent in your messaging is one of the easiest ways to stay seen in the healthcare world. And when I say the healthcare world, it's your providers, it's your insurance companies, it's your FMLA paperwork, your medical leave of absence, it's your accommodations through school and work. You have to self-advocate and you have to stay consistent in your messaging. One of the easiest ways to stay consistent goes all the way back to step number 1 in this process of finding a concussion provider who understands what's going on. They can help relay that information, giving you legitimacy and giving you a consistent message to relay to the different providers in your treatment system and the different parts of your concussion support team to ensure that you remain visible throughout your concussion recovery to the healthcare world. The second part of this objectives in becoming visible again is the idea that we need to become visible to others. And what I mean by that, it's not that people around you can't see you anymore, right? It's not that you're the invisible man or walking around with the Harry Potter invisibility cloak on. The idea is when we become invisible is we're either, number one, not around, right? We're not going to games anymore or practices or school or work. We're not going out with family or friends to dinner or going to big social events. We become kind of left out or cast off to the side, and it's kind of that out of sight, out of mind process. But we also need to make sure that we're understanding and relaying the message on what we need from our concussion support team. And we talked about it at the beginning. I also want to cover what we need to do as a concussion support team in this world to make sure that we're remaining visible to somebody in their concussion recovery. So step 1 to that, again, is establishing that concussion support team. In a perfect world for concussion support, the concussion support team has the individual in their concussion recovery, very active, very present, going through your recovery process. You have a concussion literate provider or somebody trained in concussion management who can help you navigate the healthcare side, the insurance side, the Family Medical Leave Act side, the accommodations to work, school, and play, to make sure that we're having all of those accommodations provided to you and communicated back and forth. The third part of effective concussion support team has somebody who is with that person every day. A spouse, a relative, grandma, grandpa, best friend, coworker, employer, boss, supervisor, teacher, school administrator, somebody who is on that emotional level that you trust. It can be a pastor or somebody on the religious side of your life. It can be a mentor in your life. It doesn't have to be a family member or somebody that you work with on a regular basis, but it has to be somebody that you can trust. When I talk about establishing your concussion support team, there are 3 people that you have to be honest with throughout your entire concussion recovery. Number 1, you have to be honest with yourself. You have to be honest with how you're feeling, honest with what you need and what you need to kind of do or not do to make sure that you're getting the support that you need. You have to be honest with that primary member of your concussion support team, somebody that you trust that can help you be your advocate during your concussion recovery. And the third one is you need to be honest with your provider. Everybody else, you can kind of put that brave face on. How you feeling? I'm good. How you doing today? I'm fine. How are your headaches? They're fine. Do you feel better? Yep. Do you feel bad? I'm okay. Right? The idea behind relaying as little information as possible to the outside world is okay. But when we talk about establishing a perfect concussion support team, it's a healthcare provider that's trained in concussion management. It's the patient themselves, and then it's somebody that you trust on the support team that you're seeing on a daily basis. When you're providing support to somebody, whether you're on the healthcare side or you're a family's friend, spouse, the idea behind feeling invisible does not only fall into the patient. We see a lot of times, especially longer term concussion recovery, and my running joke is that I become marriage counseling because the support system and the support provider can feel unappreciated and can feel invisible to the concussion patient because they don't communicate openly back and forth. They're not relaying what they need as the individual part of the support team in terms of establishing their expectations, and they don't have the expectations of the full team. So step 2 in this process is we need to sit down in person or on Zoom or on a virtual call, but we need to sit down to make sure that all members of that concussion support system have clear expectations on what is needed. This conversation does need to be driven by the person during their concussion recovery, but it is an open communication and open dialogue between all parts of that concussion support team to ensure that the needs of each individual section are heard. The challenge comes when it comes to open communication is, as somebody struggling with my concussion recovery, I don't know what I need. I don't know what support that I need or things that I am seeing that I need to kind of establish during my concussion recovery. And that's where the other 2 parts of your concussion support team come into play. As a provider, I know what most people need or what most people are struggling to relay during their time together, but it's not something that I know how they're feeling on a day-to-day basis. So by providing support from the healthcare side, I can relay the information that most people need to hear, certain things to keep in mind, certain things to kind of focus on. And the idea of establishing somebody who is around you 24/7 or around you every single day, they are able to provide expectations on what they're seeing with you. And it also opens up the communication between you two on what you need to have the communication wise and what expectations you have set in place. The biggest breakup or the biggest kind of fault that I see in a effective concussion support team is that communication stops. It either, number one, stops completely. You're not talking to each other on a regular basis. You've set your guidelines, but as concussion recovery has progressed, you haven't updated what you need or what you expect. And that concussion communication comes one-sided. It comes from the healthcare provider telling you what you need, or it comes from a support team member telling you what you need. It's not an open communication and dialogue between all parties of your concussion support team. When we talk about a bigger concussion support team, everybody will see you a little bit differently throughout the day, right? If I have a son or a daughter that's hurt, I see them at the beginning of the day. They go to school. I don't see them for a long time, and then I see them at the end of the day. I have no idea what's happening in the middle of the day. So I need somebody in the concussion support team that sees them during the day that can provide that feedback to make sure that we are having open communication on expectations and changes both ways. Going back to the idea that I presented at the beginning, becoming visible again is a choice that you have to make. This is the most challenging part of concussion recovery, is establishing open communication and honest communication both ways. One of my jokes during the initial kind of evaluation side is, during the ups and downs of this, you may say things to people that you don't mean. One of the areas of the brain that gets disrupted commonly is in charge of the filter that we have, the link between what we think in our head and what we say out loud. We may lose that during our recovery. The other challenge of that is the influx and mood swings that happen. We need to be very vocal and honest about what we expect from both sides. And we can never take anything personally during concussion recovery. Brain injuries are a 24/7 job. The idea that the brain is constantly working to heal, the person is using energy and effort to constantly recover and fight through symptoms and kind of work with their brain in the chaos of life. We need to make sure that we're not taking things personal on a bad day. It's really easy for me on the outside to say that. It's really easy for a member of your concussion support team to say, hey, you're being a jerk right now. It's really hard to hear that, and which is why we need to have open and honest communications on both sides of the concussion support team, not just the patient dictating what they need, or not just the support team dictating what we expect. We need to make sure that we're having open and honest communication throughout the entirety of your recovery. One of the challenges when we feel like people are becoming invisible to the people around them is that we're not openly communicating the farther away we get from the injury date. At the beginning, everybody's around. Everybody's there for you. They want to help you. They want to make the modifications. We're here on the same team. We got you. We're all moving forward. We're all going the right direction. The farther away we get from the injury date, it's almost like people get tired. They get fatigued. They don't see anything, so they forget that you're dealing with this. You've had 3 really good days in a row, and now all of a sudden you have a bad day. Well, I didn't know it worked like that, right? As somebody on the concussion support side, I didn't know you could fluctuate like that. I didn't remember you were dealing with it, or you haven't openly communicated how you've been feeling, so you're sitting here going, well, now all of a sudden you're telling me everything's miserable. All I've seen is great things. So you need to be able to have that open communication both ways. One of the analogies that I use is the idea that concussion recovery is like pushing a boulder up a hill. When you're doing it by yourself, it's really hard to do. If you need a break to take a break, all of a sudden that boulder starts rolling back downhill. If we can get 5 people, 10 people, 12 people, if we can get 2 people on the same side of that boulder, pushing the boulder up the hill, we can help make up slack, or we can help continue to push on good days and bad days. We're all pushing the rock in the right direction. It's easier to complete that concussion recovery. This is the most challenging part of concussion recovery when we talk about feeling invisible and becoming visible again. The meanest person that we know is the one that sits between our ears. It's the most critical. It's the most self-harming. It is the one that focuses the most on the negative aspect of things in life. It can be human nature, right? When things are going bad, it's challenging to see the good. It's really easy to fall in that spiral. One of the ways that I kind of talk about concussions is it's kind of like a snowball rolling downhill, or again, back to that boulder analogy. Once the boulder stops rolling downhill, it's really hard to keep it from continuing to roll. So once that boulder starts rolling downhill, it's really hard to stop that boulder and then push it back up the hill. It's really easy to fall in the trap of, I feel the same way. I don't remember, I wake up feeling the same way. I go to bed with headaches. I go to bed dizzy. I know that at 3 o'clock in the afternoon, I'm going to hit a wall where I'm going to feel like I need to go take a nap. It's really challenging to fight through some of the dark times, some of the negative times. But when we talk about becoming visible to yourself, we have to start that process, and we have to make sure that we're making a conscious effort to be seen. We can't just assume that people around us know how we feel, or assume that people are continuing to remember that you're struggling through concussion recovery. It goes back to what we talked about with the concussion support staff, or the support team. We have to make sure that we're openly communicating to ensure that we're being seen. Outside of brain injuries, when we feel like we're becoming invisible, right? When we feel lost or trapped, one of the easiest ways to be seen is to talk. If I'm in the crowd of people and I'm lost, we talk about it with young kids. If you're ever lost, you go to the front desk at Walmart and tell people that you're looking for your family. You go to the corner booth at the carnival and say, hey, I'm lost. I can't find my mom or dad. And what'll happen? They'll come on the intercom. We have a lost child. And, if you're Mr. and Mrs. Smith and your daughter is up here at the front, please meet your party at the front desk or at customer service. The easiest way to be seen is to openly communicate. So when we talk about becoming visible to yourself, this is my soapbox. This is the one thing that if I could sit down and bottle something to get everybody to take at the very beginning of concussion recovery, it's the idea that you matter. You're seen, and just because there may be days where you don't feel that way or people that make you feel invisible, you are valued, you're heard, and now we need to make sure that you stay seen throughout your recovery. Step 1 through this, it is probably the most important thing that we talk about during concussion recovery at the Midwest Concussion Clinic, and it's the one thing that I kind of take as my key message to every single presentation that I give. Is a happy brain and a positive brain heals faster. One of the most difficult parts of concussion recovery is finding a positive mindset. Not only because symptoms are hard, we have low energy, but because physiologically we have a chemical imbalance or a hormone imbalance that's making us feel depressed. A very basic definition of what depression is it's a brain going slower electrically than it wants to go with a hormone imbalance. A very basic definition of a concussion is a brain going slower than it wants to go with a hormone imbalance. When we start looking at depression, it's very easy to feel like there's a stranglehold on us during concussion recovery. The challenge is we have to find a way to break out of that stranglehold to establish a positive mindset during concussion recovery. Again, sitting on this side of the computer, sitting on this side of brain injury recovery, it is very easy for me to sit here and say, hey, look, we need to establish a positive mindset. We need to stay, we need to stay positive. We need to look at the good versus the bad. It is very hard to do in reality. And that's where I will constantly remind patients that you are not alone. You are seen, you are heard, you are important. And in terms of establishing a positive mindset, we need to keep messaging consistent. As a concussion support team, we need to make sure that we're relaying that information consistently. Concussion recovery can be really challenging. One of my go-to analogies is this: a very small snapshot in time. Let's say you've been dealing with concussion symptoms for 3 months, for 6 months, for a year, for 6 years, for a week. In the grand scheme of life, 6 months in time based over 35 years is a very small snapshot in your life. Every day you wake up in it, it feels like the end of the world, right? It feels like I'm constantly stuck in the mud, just spinning my tires. So when we start looking at trying to change mindset or change perspective, we need to make sure that we're focusing on the positives. A challenge that I find in concussion recovery is when I'm talking with a patient, I want to know the things that are making them symptomatic. I want to know throughout the day all of the bad things that are occurring. The longer I work with a patient, the less I'm trying to ask negative questions, and the more I want them to focus on the positive. It's really hard for that mindset because on my end as a concussion provider, I need to know the deficits that we're dealing with. I need to know that every time we turn our head to the left, we feel like we're going to pass out, or every time we stand up, we see stars and the world's turning black and we feel like we need to sit down. Like, that's a really negative aspect, but I need to know that as a provider. So one of the ways that we work on trying to establish a positive mindset with somebody during their concussion recovery is actually, something that we kind of focus on a regular basis. One of the easy ways that we can do that is reestablishing daily exercise into our routines. Exercise is medicine. One of the ways to release our happy hormones is to get aerobic exercise in. So when we look at trying to change mindset and trying to become visible to ourselves, we need to make sure that we have a positive outlook on kind of our position. And one of the easiest ways to keep those happy endorphins and keep those happy hormones kind of being released is to focus on daily exercise. Now, what do I mean by daily exercise? Taking day one, like word number one, daily. We want to do something every single day in terms of trying to elevate our heart rate. Exercise is where the fluctuation comes into play. Depending on your physical activity level, depending on your pre-injury activity level and your post-injury activity level, exercise looks different to everybody. The research says that we should be doing light to moderate aerobic exercise on a regular basis. Okay, well, again, what does that mean? The easiest answer, get outside and go for a walk. Trying to go for a walk around the neighborhood, going out and walking outside in the sunshine, in the elements, getting out in nature is one of the easiest and free forms of daily exercise that we can do. If I have a patient that's really struggling symptomatic-wise, it's a really bad day, I'm overstimulated, I'm dizzy, I'm nauseous, I'm lightheaded, I will talk about doing as much as we can to limit stimulus, wearing sunglasses, earplugs, noise-canceling headphones, and then getting outside and going for a walk in a calm environment. Having the ability to put our feet in the grass and get the sun to hit our faces is one of the easiest ways that we can focus on the mental health aspect of things. The idea behind keeping us in a positive mindset, keeping us happy and energetic and entertained and kind of engaged throughout life. We talked about a little bit with the depression side of things. One of the hardest parts during concussion recovery is when I have a bad day is to get up out of bed, is to get up and go do something. By going out and going for a walk or doing some light aerobic exercise like a stationary bike, it's an easy way to keep our heart rate elevated, to get the positive hormones flowing, and to keep us upright. When we talk about ways to become visible again, establishing that routine of I wake up, I do I go to work or I go to school, I come home, and now I have my daily exercise routine that I need to do. It keeps us going. It keeps us kind of focused on becoming visible and becoming seen again. I've touched on it a little bit, but this is where I want to kind of reiterate what I mean by becoming visible again. It's not that people don't see us. It's not that people don't hear us or that people aren't listening to us. It's that we're often misunderstood. We're often cast to the side. We can be forgot about. So when I talk about becoming visible to yourself, it's not that you look in the mirror and you don't see anybody. It's the idea that we don't recognize that person. We mourn who we used to be. We make comments with patients a lot where they'll come in and say, I used to be fun and energetic. I used to go out with friends and family, and now I just come home because I don't feel good. That idea behind, downplaying the severity or downplaying the actual day-to-day activities that they're doing can be really challenging to people, because they use phrases like, I was only able to do this, or, I went out for a run and I only ran a mile today. Like, well, hold on. You got out and you ran a mile? That's incredible. Like, that's great. Trying to work on establishing a positive mindset, we spend a lot of time trying to change negative language. And one of the challenges with changing negative language, again, goes back to the small snapshot in time. I'm working with somebody once a week, twice a week, very limited time frame. There's 168 hours in a week. If I see somebody 2 hours a week, that means there's 166 hours of the week. They have to figure it out. And when we can work on trying to establish positive mindsets and try to change to positive language or positive reinforcements, it's one of the easiest ways that we can maintain being seen as a patient. And one of the easiest ways to feel better about ourselves is to get out and do some daily exercise. Something that I try to bring into the forefront for patients is one of the best forms of physical activity following a concussion is yoga. The reason being, yoga focuses on balance, coordination, mindset and positivity, and breathing and breath control. Like, if we look at a perfect world and perfect exercise for concussion recovery, it's that right there. It's the ability to focus on all of those at the same time while increasing my heart rate. So trying to focus on including daily exercise is something that we need to bring through with each individual patient. It is a fine line, though, between doing too much and not enough. Getting out and going for a walk for 5 minutes is better than going out and going for a walk, for 30 minutes, but my symptoms spike. It's better than not going out for a walk at all. This is where working with your concussion support team can help you establish what's a good routine, what's a good exercise to do, and how long we need to do them. The third step that we need to establish in order to kind of become visible to ourselves again is establishing a healthy way to offload stress. That is very difficult. One of the first questions that I will ask patients during concussion therapy is, do you have an activity that you like to do that you offload stress? The challenge is, for most people, those activities that we do on a regular basis to kind of make it our happy place cause symptoms. Reading, playing video games, coloring pictures, drawing, going out and working out, or lifting, or riding a bike. Those are all activities that people do to offload stress on a normal basis. That can cause symptoms during concussion recovery. We have to find healthy ways to offload that stress. One of the first things that I focus on with patients to establish is making it so one of those activities that's your happy place is no longer causing major symptoms or no longer causing a significant increase in symptoms. If we can establish even a location, right? I like to go out and sit in the garden. I like to go out to grandma's house. I like to go sit in my car, right? Those happy places, if we can establish a location and an activity that we can use to offload stress, it can make us feel seen, it can make us feel heard, and it can make us, improve that self-image that we have during our concussion recovery. When we talk about establishing healthy ways to offload stress, one of the easiest methods is free. Sit down and breathe. Focus on controlling our respiration rate. Big deep breaths in through your nose, slowly exhaling through our mouth, finding ways to optimize offloading CO2. An analogy for this is when we have a busy day, when you're stressed, when you're irritated, when you're not even brain injury recovery, when we come home from work or school and we had a rough day, the first thing that we do is we sit down in our favorite chair or the couch and we lay our head back and we go, whew, that was a tough day. Okay, now that I've sat here for a little bit, I can get up and go again. The challenge with brain injury recovery and concussion recovery in general is we don't have that ability to do that. From a physiological perspective, from a somatic, fight or flight response perspective, we don't have the ability to do that. Sit down, take a big deep breath naturally, and offload stress. We have to physically make it so we do that personally. So when I'd sit down and talk about ways to establish healthy stress relieving techniques, the first one that I do is I provide a list of 6 breathing techniques that we can do that are free to everyone, that a lot of times it just takes you sitting down and putting in a conscious effort to breathe. When we can sit down and breathe, we can trigger the brain out of a fight or flight response. We can get into a rest and regenerate mode and that parasympathetic relaxation. And we can start to focus on the ability of maintaining feeling seen to ourselves. The challenges of all of this, right, from establishing a communication team or a concussion support team, staying visible to the healthcare world, staying visible to ourselves, the challenge is we have to stay consistent throughout this process. It's very easy to slip, very easy to have good days and bad days, and this is where all parts of your concussion support team need to be in open communication to ensure that the patient, that somebody struggling through concussion recovery is feeling validated in their symptoms and feeling seen. When we feel seen by other people, when we feel understood or we feel cared for, it's a lot easier to feel seen to ourselves and a lot easier to be visible to that person that's looking back at us in the mirror. One of the biggest challenges that we have in the healthcare world, or even in concussion support in general, is the idea that we become invisible and how we become visible again. This entire webinar is something that I am very, very passionate about and something that I can talk for days on ways to get you to be visible again. And it's a concept that not a lot of people cover. During this entire webinar, we talked about the ways that you become invisible in the first place, the ways that healthcare doesn't see you, that people around you don't see you, and that we lose the ability to see ourselves, and ways to become visible again to each one of these. Again, I broke it down into simple steps, 3 simple steps. It sounds really easy. So you say, you do these 3 things, people are going to get it. You do these 3 things and you're going to get it. You do these 3 things, you'll get better faster. In reality, those 3 steps are a basic building block for a foundation that needs to be addressed. And how we plan on addressing that is I plan on expounding on this topic. If you have a question or a concern or a technique that you've used that's worked, please, please, please reach out and provide that information to us. That way we can add it to what we're doing to ensure that patients around us can see that, and around the people that are providing support can provide that extra element of you're seen, you're heard, you're valued. The big key takeaways for this presentation today is that you are not alone in your concussion recovery. If you're somebody on the healthcare world that's watching this, you need to understand the totality of the injury. Just because you're on one part of that treatment plan does not mean that you can forget about every other aspect. If you're working from vision therapy or a vestibular therapist, a physical therapist, a speech therapist, a neurologist, a physiatrist, if you're a primary care or family medicine or pediatrician, if you have your specialty and you're a concussion literate provider, you need to make sure that you understand every single aspect of that concussion treatment team and that concussion treatment kind of roadmap. If you don't understand it, reach out. I can help you. I can provide that education to you. And last but not least, we need to make sure the mental health side is addressed during the concussion evaluation and constantly addressed during concussion recovery. Concussions are considered an invisible injury, and when we look at being invisible, it is very challenging to become visible again. One of the biggest things that I am passionate about during concussion recovery is making sure that we are treating people and not numbers. At the Midwest Concussion Clinic, my goal is to make sure that every single person going through their concussion evaluation, going through their concussion recovery journey, feels seen, feels heard, and feels appreciated. Again, my name is Matt Campbell. I am the owner of the Virtual Midwest Concussion Clinic. We provide expert concussion care, evaluation, and advocacy right at the comfort of your own home. If you are somebody who has questions, comments, you want to book me for a speaking engagement, you want me to teach you my methods, please reach out here. I've got my contact information on the screen. I answer emails, calls, text messages. My whole goal is to help as many people navigate concussion recovery and provide concussion support as possible. Thank you for tuning in. I hope you have a great rest of your day. And as always, don't feel lost. Don't feel invisible. Being visible can happen for everybody.